Time for our debate this hour. The Tory leadership hopeful and former Chancellor Rishi Sunak says he would introduce a £10 fine for patients who repeatedly miss GP or hospital appointments, as he pledged to cut the NHS backlog if he becomes Prime Minister. National Health Service figures from 2019 suggest more than 15 million general practice, this is just GP's appointments, 15 million GP appointments are wasted each year because patients don't turn up and fail to warn surgeries that they will not be attending. Of course, you have to be able to get through to them to tell them you're not coming, not always easy, costing the health service £30 on average per missed appointment. So we're asking, should we fine people who miss NHS appointments, as Rishi Sunak is suggesting? We're joined by the NHS GP, Dr Veena Babu, and the Head of Lifestyle Economics at the Institute for Economic Affairs, Christopher Snowdon. Welcome to you both. Veena, if we can start with you. I mean, I know you have within general practice, I'm told, what you call heart sink patients. Your heart sinks when they walk through the door because they tend to present a lot, and oftentimes they don't need to. But at least they're turning up. How many people just don't even bother telling you they're not turning up?
Hi, Colin. Thanks for having me. Yes, there might have been a large amount, but I think the first question I'd want to kind of ask is that data is from 2019, back when all appointments were face-to-face. So yes, there might have been a larger amount of people not turning up, but now with 50% of appointments being telephone or remote, there's a lot less scope for someone missing their appointment. And even if there is, I think you should then pose the question of why have they missed it? Are they a vulnerable person? Rather than holding accountability, I think we also have like a clinical responsibility towards the whole situation. So on this occasion, I'm not on the side of we should charge them. Yes, there should be a warning. Maybe the third account you charge them, but where does that money go? Is anyone going to see that money? You know, I have patients who are struggling to put food on the table. This is not the time to punish people. This is the time to empower people and to educate them and make them understand. So I think, yes, I see where they're coming from, but the data was from 2019, and I don't think that applies right now.
Christopher Snowdon, I mean, given we're talking about Rishi Sunak's idea, a tenner as a fine per missed appointments, given the cost of admin and all that stuff, it's not really a revenue-raising measure, this, is it? It's about deterrence.
Yeah, it is, but I don't think it goes far enough. Actually, what I would like to see is everybody paying £20. I think probably something in that region to see a GP in the first place, and you prepay that as well. So if you don't turn up, you pay the £20 either way. Because the bigger problem, which you've already alluded to, Colin, is not just people missing their appointments, as bad as that is. Although I do hear some GPs quite like it when people miss their appointments because it gives them a chance to catch up with their own little backlog on the day. But it's really people turning up for frivolous reasons. You know, if you make things free and people don't adequately value them. And so you hear stories about people turning up essentially for a chat, or maybe just to get some free paracetamol, or with, you know, really stupid conditions that they should be able to work out for themselves are going to go away on their own. So I would like people to actually value GP appointments a bit more by actually paying some of the cost out of pocket. We are paying for it anyway. I mean, whether we pay it through the tax system or out of pocket, we're all paying for it. But I think that would make the system more efficient, make people value them more, and there would probably be fewer GP appointments because people would actually think, do I really need to see a GP about this yet? Probably not.
Yeah, Veena Babu, just on that point, and I know it's extending our conversation a little bit, but that idea that if you pay for it, you're going to turn up when you need to turn up.
Yes, I agree. People do value things when they have to pay for something more. We saw that in the pandemic as well, where there was risk to people's lives and there was so much uncertainty. A&Es were empty. So it poses, where was everybody who sits there for 4 hours? Where was everyone? But what happens with that? Yes, of course, there's deterrence. But what about the vulnerable groups who can't afford it, who already think by turning up they're causing a problem? That's going to deter them even more. And when they then present, it's going to be way more complications. So on that front, I do agree. It is a deterrent, but I think we need to look at the entire economy of who we're providing this healthcare service for. It's not the well-off, comfortable patients for whom a £10 is not a big deal. It's for your average person who's really struggling and needs basic healthcare.
Christopher Snowdon, devil in the detail. I mean, in terms of how you administer this, I mean, aren't you putting into the hands of GP receptionists, essentially, a role that hitherto they've not had? They would have to determine whether somebody's got a reasonable excuse for missing their appointment or not. And as we all know, GPs, receptionists, some of them are terrific and efficient and friendly. Some aren't.
Well, I mean, GP receptionists seem to have taken on a rather broader role since the pandemic anyway, of kind of checking you out and triaging and making sure whether they think that you're suitable to even see a doctor. I mean, none of this comes into it if you use my system of charging people. On the point that's been made about, what about the poorest people? I mean, obviously we're always going to get this conversation about any policy rather than looking at it from the point of view of the average person. But this would raise something like £5 or £6 billion a year if we charge people £20, and we can use that to help the vulnerable people. This could be quite a progressive system. Either we could reduce taxes on things that everybody buys, which would help people on lowest incomes most, or we could just directly add it towards benefits. So, as I say, we're paying for this one way or the other. We're already paying a vast amount of money through the NHS, through the Department of Health for this. It's a question of how we do it and how we make it more effective and efficient, and stop GPs having their time wasted, which we all know that they do on a regular basis.
Well, I think Rishi Sunak started a conversation. Whether it goes anywhere is another question. Christopher Snowdon, Vina Babu, thanks both for your time. Really appreciate it.